welcome to this second part on chronic kidney disease. In this part, we look at what are the current and latest treatments available for chronic kidney disease. To begin with, we will be looking at what are the most common treatment options in kidney disease.
Kidney disease, if it's an acute renal failure, that is usually kidney disease occurs because of toxin level. If it's an acute exposure of a toxin, we can do dialysis and remove the toxin and kidney will recover. So it is very, it's almost 99 or even 100%. If usually this acute renal failure patients, you can save the patient with the dialysis. But when it is chronic renal failure, it is actually, this kidney is having around 1 million nephrons, that is the smallest unit of the kidney, and these nephrons will be reduced. So once the nephrons, 1 million nephron each kidney, and even only one kidney is there, then renal function test will be normal. Even the GFR will be above 90 only if the one kidney is properly functioning. So that means if the kidney failure reaches only when there is only very few nephrons are there, then only it will go to fifth stage and all. So it is very important that diagnosing it at an early stage. If it is an early stage diagnosed, we will be able to, this not fully damaged, but some nephrons will be only partially damaged. That will be able to recover, make them recover. And that is one thing when we are talking about the treatment, the patients will always, and the general population always think there is some medicine which can improve the renal function. That is, for the acute renal failure, definitely we have some supportive treatment we can give, and also dialysis will. But the chronic renal failure, we can save the kidney only by finding out the reason for the renal kidney is damaging, and then correcting reversing the problem. For example, type 2 diabetes, that is one of the most common cause for the renal failure. If the type 2 diabetes, then what will you do? If the renal failure is also, again, we'll immediately give insulin injection. In type 2 diabetes, there's no insulin deficiency. High insulin hyperinsulinemia, that is excess insulin in the blood, is actually damaging to kidney. So what we had to do is reverse the lifestyle factors. If it is a diabetes, there will be hyperinsulinemia and excess fat in the body. We have to reverse that and avoid medication. But generally, there are reports. This medical profession, what usually a nephrologist tend to go ahead and maybe a team of doctors, one diabetologist or cardiologist and a nephrologist, they're working with from the available medicine, which medicine is good. So in that way, there is some directions in general, like these medicines are beneficial, it's okay for the kidney and with hypertension. This medicine is okay for the diabetic with nephropathy. But actually speaking, no medicine is good for the kidney because it will definitely increase the workload of the kidney. So we should everyone should understand that chronic renal failure, acute may be because of some other reasons which is not in our hand, but chronic renal failure is because of the lifestyle disorders, and it is in the patient's hands, the correction. It is not for the doctors or the hospitals. They can do finally dialysis and renal transplant. That the patient should understand that diagnose early and reverse the basic factors which is affecting.
Actually, you are talking about medications and all. Generally, people who go to a medical setup for managing their kidney disease or for taking treatment for kidney disease, they will be going to that setup basically thinking that they will be getting the right medications in the form of treatment. But from what we understand is that medications, their effectiveness for managing kidney disease is something that is sometimes questionable. So what is the approach that medications have towards treatment of kidney disease?
See, medication, any medicine, it is harmful for the kidney. That we should understand that. But kidney will forgive. If your function is okay, kidney will forgive, tolerate medicines and all. But if you are already on the kidney failure, the kidney, whatever medicines you are using, even the safest for the diabetic patients is considered as the insulin. Insulin itself is harmful for the kidney. And insulin has so many other, and I'm specifically talking about the insulin and the diabetic medication because of the, it is type 2 diabetes. We are actually taking, the patient with the type 1 diabetes needs insulin, but type 2 diabetes already there is excess insulin. Excess insulin is a problem for the kidney, but we are treating with again with insulin injection. That is actually, it is came in our medical practice. This insulin, 100 years back, insulin is we found out and started using it in the medical practice. That time we was not knowing about what is the action of the insulin and all. And later when we come, the science has improved a lot. But the medical, the people are concentrating on the medicine and the surgeries for the cure. But we are not using the lifestyle factors or the general scientific improvement in the healthcare. Actually, it is not the medicine which can cure you really. It is understanding about your body's functioning and correcting that, making it in an optimal way that can reverse the problems. They reverse the lifestyle disease and reverse the renal function, renal problem at least to some extent, and maintain it in that stage. That is what we can actually do.
Actually, though in kidney disease, surgery, that is with respect to transplant, is well known. But at the same time, some other disorders also need surgery with respect to the kidney. That is, some kidney problems will require surgery. Now, what are the conditions in which these kidney patients or kidney disease patients require surgery?
See, kidney patients usually either they will be diabetic, or they will be hypertensive, or they will be obese. These patients will be undergoing either this diabetes related problem, surgery may be needed, or the heart related, because hypertension they'll be having usually most important is actually when they get a chest pain, they will be advised for a angiogram. Angiogram, the contrast eye is needed. And the patient's GFR may be 60 or 65 or something like that. But after an angiogram, it will go dip to the stage 3, 45 or 40. It is usually, I'm seeing such patients regularly. And if after an angiogram, they'll ask for a stent. Sometimes primary angiogram, stent is put together. And after the stent is put, then at least 2 medication is needed, and it is also straining the kidney. With the stent, angiogram and stent application, the kidney function is gone down. And again, because of the stent, to prevent clot formation on the stent, at least 2 medicines will be needed. 2 or 3 medicines usually given. So this will again further deteriorating, may not be, the kidney is very forgiving, so it may not be fast, but it will be gradually deteriorating. So this any surgery, any medication, when the surgery is needed, there will be definitely anesthetic medicines will be needed, and also antibiotic to prevent infection and all will be needed. It will all deteriorate the renal function. So if you are having a renal problem, you should see that you should not have any surgery, especially for the lifestyle disorders, because it can be a reversible thing. But unfortunately, if you get an accident or an infection, then you may need, even infection will come only if you are having, when your immune system is at stake. If your diabetes is reversed and the hypertension is reversed and heart disease is reversed, then the chance of infection also will be very less. So you cannot, if you are kidney patient, you cannot have much of medicine. So you should keep yourself healthy. That is the most important.
Actually, when we are talking about kidney disease treatment, as you mentioned, medications, there is a lot of limitation Then normally the medications that are associated with chronic kidney disease are for other comorbidities and all that. Then regarding dialysis also, it has its plus and minus and risk and associated discomforts. Then transplant also is something like once a transplant is done, then it's a lifelong, rest of the life management issue. Even then, why is it that, from what you said, with the lifestyle correction, people can actually manage things better, they can have more control with themselves. In spite of that, why do patients usually prefer to suffer even waiting in the hospital or undergoing procedures and long-term suffering, and they don't somehow understand that their lifestyle corrections can make a big difference?
First thing is the current trend. Everything is according to the trend actually. See, for the last 100 years or the 50 to 100 years, it is actually this modern medicine is replaced even in the other, everything we are definitely looking for the modern medicine. Actually, we are depending on the modern medicine. When I started my medical education and all 40 years back, see, everyone is seeing this in Ayurveda in our part of the country. Ayurveda, this modern, this Indian medicine system was very prevalent. In Ayurveda, the importance was actually in the food. There are so many pathya, that is, food restriction will be there. So, in the modern medicine doctors saw it, even I am, when I was a student, it's all very primitive. It is pathya, that food restriction and all is very, very unscientific sort of thing. And it was the situation in the modern medical, even in the most of the modern medical doctors are seeing it, these things are very irrelevant. But the real scientific evidence are there, the science is so much of improvement. But it is not coming into the medical, we cannot say that it is the medicine actually. The modern medical doctors are trained in giving or in any system of medicine. They are trained in using the medicine in the way it is approved and also doing surgeries. In between, this development in the life science is ignored, and no one is there to guide the patients according to the lifestyle. And also many of the patients are also not interested. Even the doctors, someone is interested and try to give lifestyle advice, no one is following it. So naturally the doctor's interest will also go. Even someone is interested, it is will not persist for a long time. Because type 2 diabetes patient reduce the weight, otherwise your kidney is already damaged, reduce weight. They will not, because another reason is taking the medicine. The person who is taking anti-diabetic medicines, they will not be able to do the food control, because if they reduce the food, they will get a hypoglycemic attack. So the system is the problem. This the one thing, the modern medicine is about mainly the medicine and surgery, and patients are also looking for the easy solution. Just give me medicine, I will eat it. That is the attitude. Or do whatever surgery you want. I don't want to get pain. Only thing, give proper anesthesia and operate whatever you can do on me. That is the attitude. That has to change. We have to understand that our body is made of food. And the older Ayurvedic tradition of Padyam is very, very important. And that is, our ancestors may be knowing about detail, but the modern doctors, even the Ayurvedic doctors, may not be knowing the science behind it. But now the modern medicine science is there. Life sciences are incorporate the life sciences, the latest development along with for the lifestyle modification. According to this modern medicine, modern life sciences, and using the diagnostic methods, you can solve all these problems. That is, I am telling from my experience, not from any theoretical knowledge or from the internet or anything. I am talking from my own experience in treating this sort of patients.
Actually, when we think about this kidney disease, as we mentioned earlier, it is very stressful, mentally stressful, financially stressful, and even the caregivers or supporters or family members also find it very distressing and difficult and all that. But in spite of that, we find that the, as you mentioned earlier, the science is not so much understood, and even the patients also show reluctance. They think that they will be able to get some easy solution from the medical system. With all these sort of complexities, when a patient comes for a lifestyle oriented treatment, what is it that you find in those patients that is different from the general?
See, those patients comes to me, they first understand something about this. They will be, the patients who are coming, usually they search in the web and come to know about my way of treatment. They will be seeing the videos and all. Then one patient actually last day, they're saying that, Doctor, I was watching the video till the end, and only by the end you said about the solution. And then I had gone through other videos and all the searched everything in this. Then I have come over. So that is the usual, because it is the world is so many now in the modern society. There is not much of the one person to another person. That sort of communication is also very less. And also, many of the patients, those kidney patients, especially those who are already on treatment, when they come across any other patient who is going for kidney disease or advised dialysis, they will also send. And the patient, the particularity of the patient who's come, they should understand that they want to avoid the dialysis or to protect their kidney. There were patients who, after seeing the videos and informatory videos we are putting also, they understand, many of the people are understanding about the GFR and all the first time. And even they will be looking into their older reports and it is already low, but their doctor is not told anything about them, the kidney problem. Or they go for the GFR test and come that my kidney, the problem is there. There are patients who come and correct it, and the GFR is around 60 and all. You can get it corrected. And if the young age, it will be very easy. But in older age with diabetes and hypertension, they can come out of the medication. That is what we are giving. So, if the patient is willing for a lifestyle correction, for to protect their kidney and avoid dialysis and going for a renal transplant, it is very easy actually if you are diagnosing in the early stage. But if at a late stage also, many of the patients who are even 6, 7, 8 creatinine level and all, that is when in late stage of even the end stage, very late, they can also go comfortably without this. First thing we will be doing is making them come out of the medicine, and the kidney function will gradually improve to some extent. Don't expect it to be fully corrected, especially in the, if it is early stage, it can be fully corrected. At least fully correction also doesn't mean that the kidney is fully normal, but the GFR level can be improved. That is. So basically, everyone should understand that there is a possibility of correcting the lifestyle, correcting this lifestyle disease, especially the chronic renal problems, with the lifestyle correction, and understand that there is no medication and each medicine is actually increasing the workload of the kidney.
With this, we come to the end of the second part, where we were actually looking at what are the latest developments in chronic kidney disease treatment and the reasons why there are so many limitations in this aspect, and it is so important that patients and their relatives and caregivers understand what are the options available and how they should go about treatment, in the future. Thank you.